Heart disease is the leading cause of death in the United States, and increasingly so in other parts of the world, in both men and women. To reduce your risk of heart disease, take proactive steps such as eating a healthy diet, engaging in physical activity, maintaining a healthy weight, quitting smoking, controlling your cholesterol and blood pressure, drinking alcohol in moderation, and managing stress. Certain factors increase the likelihood of developing heart disease, including having high cholesterol, high blood pressure, or diabetes, smoking, being overweight or obese, and not getting enough exercise or following a healthy diet. Additionally, age and family history play a role, with women over age 55, men over age 45, and individuals with a family history of heart disease being at higher risk. When referring to heart disease, most people are discussing coronary heart disease, CHD, or coronary artery disease, CAD, which is the most prevalent type. This condition occurs when plaque buildup from cholesterol, fatty materials, and sugar in the blood narrow or block the coronary arteries, causing chest pain or heart attacks. Common risk factors for developing CHD include unhealthy lifestyle habits, such as poor diet, physical inactivity, and smoking. High blood pressure, high cholesterol levels, and obesity can also contribute to the development of CHD. If you are concerned about your risk of developing heart disease, it's important to consult with your healthcare provider. Your doctor can evaluate your risk factors and provide recommendations on how to improve your heart health. In some cases, medication may be necessary to manage risk factors such as high blood pressure or cholesterol. Remember, even if you have a family history of heart disease or have risk factors that increase your chances of developing CHD, there is still a lot you can do to reduce your risk. By making healthy lifestyle choices and taking proactive steps to manage your risk factors, you can help prevent heart disease and maintain a healthy heart. Some additional steps you can take to improve your heart health and lower your risk of heart disease include: get regular exercise. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise each week. Exercise can help lower blood pressure, improve cholesterol levels, and maintain a healthy weight. Follow a healthy diet. Incorporate plenty of fruits, vegetables, whole grains, and lean proteins into your diet while limiting saturated and trans fats, added sugars, and salt. Manage stress. Stress can contribute to high blood pressure and other risk factors for heart disease. Try relaxation techniques such as deep breathing, meditation, or yoga to manage stress. Get enough sleep. Sleep plays a crucial role in heart health. Aim for 7 to 9 hours of sleep each night to help lower your risk of heart disease. By incorporating these strategies into your lifestyle, you can help protect your heart and lower your risk of heart disease. If you have concerns about your heart health or risk factors for heart disease, don't hesitate to speak with your healthcare provider. In addition to the lifestyle changes mentioned, it's also important to be aware of the signs and symptoms of heart disease. Some common symptoms include chest pain, shortness of breath, dizziness, and fatigue. However, some people may not experience any symptoms at all, which is why regular checkups and screenings are important. If you experience any symptoms of heart disease, seek medical attention right away. Prompt treatment can help prevent further damage to the heart and improve outcomes. It's important to note that while heart disease is a serious condition, it is also largely preventable. By adopting a healthy lifestyle, managing risk factors, and getting regular checkups, you can take control of your heart health and reduce your risk of heart disease. It's also worth noting that some groups are at higher risk for heart disease than others. For example, people of certain ethnicities, including African Americans, Hispanic, Latinos, and Native Americans, are more likely to develop heart disease than Caucasians. Additionally, individuals with a history of gestational diabetes or preeclampsia during pregnancy may also have a higher risk of developing heart disease later in life. If you are in a higher risk group, it's especially important to take steps to protect your heart health. Work with your healthcare provider to identify any risk factors you may have and develop a plan to manage them. Finally, it's important to remember that heart disease is not a normal part of aging. While the risk of heart disease does increase with age, it is still possible to maintain a healthy heart as you get older. By making lifestyle changes early on and staying on top of your heart health as you age, you can help prevent heart disease and enjoy a long and healthy life. In addition to the lifestyle changes and risk factor management, there are also medical treatments and procedures available to manage heart disease. Depending on the severity of the condition, these may include medications to lower blood pressure or cholesterol, surgery to bypass or open blocked arteries, or implantable devices such as pacemakers or defibrillators. If you have been diagnosed with heart disease, it's important to work closely with your healthcare team to develop a treatment plan that is right for you. This may involve making additional lifestyle changes or taking medications as prescribed. It's also important to stay up to date with your regular checkups and screenings to monitor your heart health and detect any changes early on. By staying informed and involved in your care, you can help manage your heart disease and prevent complications. In summary, heart disease is a leading cause of death in the United States, especially, but it is largely preventable where it occurs. By adopting a healthy lifestyle, managing risk factors, and staying on top of your heart health, you can help reduce your risk of heart disease and enjoy a long and healthy life.